who underwent multiple nerve decompressions, how long ago?
June.
June.
Mm-hmm.
And now, so we were talking about that, but I want you to tell the audience here why you came to see me and what happened to you prior to seeing me.
Well, I was diagnosed with exertional compartment syndrome and had a surgery to release the anterior and the lateral compartments, and the surgery just didn't go very well. I developed an infection and then an abscess, and then they had to go back in and debride all that. And I just lost all the sensation in my leg from my knee down to my toes, and kind of got to talking with Dr. Bregman through the Facebook group, and he seemed like he knew what the problem was. I couldn't find anybody locally to address the issue, so I flew out and he did the nerve decompression, and now I have feeling back in my foot. I don't have as much swelling. I don't have the pain, and I'm able to be a little bit more active now with it. So it's just really been a blessing. I thought that my leg was ruined forever, so it really has been a blessing for me.
And so now we're here to do the other side, because you still have the same symptoms, and you were telling me actually now you're feeling that much more because your right leg has improved so much.
Yes.
Is that correct?
Mm-hmm.
Yeah. And so we had a lot of sensation return, which also helps with your balance, because if you don't have sensation, it affects your ability to even navigate uneven surfaces and all those good things, which I'm sure you experienced.
Well, just not being able to feel the ground, I was tripping all over the place. I just wasn't able to really even walk or function, and with two young children, it's been really frustrating to not be as involved with their activities. So it's been
okay.
helpful.
So she had this one incision, which you can see. Point to your original incision. Yeah, so that incision was originally done to attempt to get to the lateral compartment and the anterior compartment of the leg, and that's actually not really an ideal position for that incision, number one. And that's where she developed all the complications. So as you can see, my first incision up top near the knee, over there, that was to release the common fibular nerve, as well as releasing the fascia in that region, the superficial and deep compartment. And then my other incision, which you see distally on the leg, about a third of the way down, just in front of the old incision, if you can point to that one, yep. That incision was for the superficial fibular nerve, which we completed the fasciotomy and released that nerve. And then on the top of the foot, you see the deep peroneal nerve incision. That area usually is the longest to recover, just because there's very little tissue in that area, and so but that nerve also was a problem as well. So we're going to go in and do pretty much the same thing we did without the problem of having the previous surgery, which does certainly create issues. So we'll be back sometime in the near future to see how this goes for the other leg.